All right, this video is for deep unwinding, chronic pain relief, focused on the front line of the body, opening the chest and hips and releasing tension along an overstretched back line. So I'm going to start by showing you how to set up. I have my bed here. You can do this on the bed, you can do it on the ground, anywhere where you have space and time to really deeply unwind. So what I like to do is get a nice pile of pillows, and if you are going to just focus on the hips, you don't necessarily need the pillows, but I always find that working the chest and the hips together produces more effective results for chronic pain relief, and so why not do both? It's pretty easy. You're just going to make a pile of pillows. You want it high enough that when you lay on it, your chest feels a nice opening without feeling overstretched, because we're going to hold this position for at least 2 minutes, and that part is really important. At least 2 minutes, possibly more. So we don't want to overwhelm our chest muscles and have them feel irritable. So we want it to be a nice gentle stretch that we will amplify by using our movements. So I find that 2 pillows is pretty good for my chest. Sometimes I like a little more, but I'm going to stick with 2 right now just because it's easier to show you. So the pillows are going to go in between your low back and upper back, so kind of in the mid back area here. So your shoulders are hanging off of the pillows. If you have neck issues and you need more support, you can put a small pillow under your neck or your head, but you'll just see how you do with it. The pillows can either go horizontally or vertically, and so if you do have neck issues, you can make them vertical for more support for your neck and head to start. The ends of the pillows are going to get tucked in under your low back hip area, and then you just drape yourself back slowly, watching your neck, supporting it with your hand if you need. And then from here, your arms just go out to the side. And just getting in that position can have a really relaxing effect. And the more you do it, the quicker your body will drop into that deep breath relaxation response. Once you are in that position, your arms are outstretched to the side, you can either stay there or you can get more active in that pose. First though, I'm going to show you how to add in the hip opener. And for that, I'm going to stay seated, so just imagine that I'm leaning back right now. For that, we're just going to bring the soles of the feet together, knees out to the side, right? So this is called bound angle in yoga. And so we're getting a nice stretch all through the hips and in inner thighs. If it's too much of a stretch for you to have your knees go all the way down, you can put pillows underneath, stack them as high as you need, again to where you feel a nice gentle stretch without feeling overwhelmed. If we go into too much of a stretch too quickly, then we're likely to stretch our ligaments versus our connective tissue. And if we overstretch our ligaments, then they can actually lead to more chronic pain and can take quite a while to heal. So we're going to go into this very gently and slowly and allow our bodies to soften into the stretch with ease and grace versus force. So finding that height that you need to feel a nice stretch without feeling too much in your groin or your knee area. And when you feel nice and comfortable there, you can just lay back. With your arms out to the side, we can then begin to move into more meridian stretches. So we're already working the front line of the body, which includes the stomach meridian, the kidney meridian, the liver and spleen meridian, and that's all very powerful, just being in that pose by itself. It opens up the digestion, it opens up our womb area, opens up our lungs and decompresses our heart, which helps with breath work and anxiety. So we're getting a really deep benefit just with this really simple pose. If you want to add in more meridian work, we can add in arm work. And the arms of the meridian are the lung, large intestine, heart, small intestine, sanjiao, which is like the lymphatic system essentially. I'm forgetting one. Oh, the pericardium, which protects the heart. So to add in work for those meridians, our arms are already out to the side. I'm going to turn just so you can see a little better. And remember, you can do arm meridian stretches seated, and I'll have other videos for that. But just imagine I'm laying down at this point. So arms are outstretched, chest is nice and open, and we're really extending strongly through the fingertips. You can think about it like your arms are taffy and they're getting pulled out gently. You know, someone that really loves taffy and just wants a piece of it, but they don't want to break it, so they're pulling it gently towards them from across the room. Or you can imagine or visualize that you have laser beams coming out through your fingertips. So you're getting a really strong extension all the way from your fingertips, down your arm, and even into your armpit and chest. And when we do this, we're really strongly supporting the lengthening of connective tissue and the breakdown of connective tissue that has bound together. And with chronic pain, connective tissue binding down is a really big issue. So the more we can work with this, the more likely we are to have effective chronic pain relief. So we can focus on different meridians when we're doing these arm stretches. Just focusing on the tips of the fingers and stretching them out will help to get the pericardium and heart meridians, which run down the palm, the inside of the arm, and up through the armpit into the chest. So if you have a lot of anxiety, inflammation in your chest, that can be a great area to focus. If we want to focus more on the lungs, we'll take the thumb and we'll stick it out. You can think of it maybe like hitchhiking, right? So sticking the thumb out and really strong extension through the thumb. So the fingertips are pointed down a little bit. We're opening up more the top of the arm here, this kind of chunky muscle. The lung meridian runs along the inside of it, up the arm again, into the chest. So if you have allergies, issues with breath, asthma, whatever it is related to the lung, this can be a great area to focus. If you have digestive issues, we can focus on the large intestine meridian, which is the index finger, the pointer finger. And so with that one, we're just doing a little pew pew, right? So pointing that and playing around with it till you find a really nice stretch through the joint here and up on the top of the arm. Lung can be involved or not. Sometimes you can get more than one meridian in a stretch, and that's great too. Remembering all the while to have that taffy pull or laser beam, stretching your arm all the way. And you can do that hold for as long as you are holding the open chest and open hip posture. But if you need a break, you're more than welcome to relax your arm, shake it out, draw it back in towards your chest, and then go back for more if you feel like you want to. The longer we can hold these sustained, lengthened stretches, the more likely we are to lengthen connective tissue and to break those sticky bound areas that are causing us pain. How do we know if we have sticky bound areas? Well, we can assess by just gently pinching up our skin. And if it comes up in a big chunk, then it's likely that we have a bound connective tissue problem. If we can pull up our skin with ease, even if it's just a little pinch, then we know we're doing pretty good. And so it will be different in different areas, even in your arm. In my forearm, I can pinch up pretty well, but in my upper arm here, I have a lot of bound areas. It's a lot better than it was because I've been doing a lot of work over the years. But I had 20 years of really pushing myself doing massage and body work without enough connective tissue care. And that's what led me down my personal connective pain spiral. So I'm really grateful to have these tools that have helped me shift out of my chronic pain and to be able to share them with you. So we did heart and pericardium, and with heart and pericardium you can also draw your fingertips back towards your head a little bit and really press from the base of the palm. That will help to get an even stronger stretch through the upper arm. To do the meridians on the outside of the arm, we can press, drawing the fingertips towards us this way, our palm toward us, and really pressing out through the outside of the wrist. feeling that all the way back up around our shoulder and maybe even into our neck. And if we want to bring that into our neck even more, if you have neck issues, ear pain, chronic ear pain, sinus issues, this can be a great area to focus on as well. So that would be just tilting the opposite ear towards the opposite shoulder to open up the neck as we press. Okay, should feel really good. If it hurts, back up a little bit, dial it back in. We don't want this to be painful. Sometimes it'll be a hurt so good, or it just feels intense, and that's fine. Just pay attention to your body, and if it hurts, dial it back. And if after a whole session of this you feel pain, take it back, dial it back the next time you do this. If you do feel pain after this exercise and you're not quite sure why, feel free to let me know and we'll make sure that it works for you. Okay, then we also have the meridians that run more on the outside here. So the small intestine meridian runs from the pinky. So if we really press strongly through our pinky, pushing it up even towards the ceiling a little bit, as we have our arm extended out to the side, we'll get a nice strong stretch through that small intestine meridian, which actually also goes up to the ear. Even though it's our intestines, the external meridian runs from the outside of our arm up to our ear, and then internally goes down to our actual intestines. It's kind of a funny system, but that's the way we developed. So as you're laying there in this open chest, open hip position for at least 2 minutes, you can hold it for longer if you like, up to 10 or 15 minutes if it feels good. You can be doing these arm presses for our arm meridians. You can be doing breath work of various types, and you can explore the breathwork options in the other breathwork videos that I send. But really it's about focusing on a deep release and an unwinding and an opening. So if you feel like you want to do spontaneous movement, I say go for it. Sometimes we'll spontaneously get some meridian stretches. Sometimes we'll want to do a side bend or spiral our wrists. Whatever it is, if it feels good to you, then go ahead and do it. When you are ready to come out of this pose, you're just going to lift your knees back up, plant your feet firmly on the bed or whatever surface you're on, roll to one side, and push yourself up to seated. You want to get up nice and slowly because we are resetting our posture with this position. And if we move too quickly, we can jolt our muscles and our connective tissue right back into where they were. So we want to avoid that as much as possible. So getting up slowly, walking around really consciously, looking, the posture and movement videos that I send, you can look at those for advice on how to consciously begin your walk for most effective posture and movement. But really it's just about paying attention to how your body feels. Okay, so hopefully that was helpful. Let me know if you have any questions and we'll get you back on track.